Hello everyone, and welcome to today's webinar for the General Maths Competencies for the Health and Science T-Level route. And this webinar forms part of a collaboration with STEM Learning for the Science T-Level qualification, but this webinar also contains information for those delivering health and healthcare science too. And the plan for today's webinar is to begin with just a few quick introductions to NCFE and STEM Learning. Then we'll have a brief overview of the T-Level and the assessments therein. We'll look at the maths competencies and where they appear in the specification, then examine each competency in more detail and what they entail, make some suggestions to further develop and embed these competencies in your delivery, the resources and support available to you, and to address any questions that you may have. Although do please ask questions throughout this webinar, as we will be addressing them as we go, and you can access the slides used today from the handout section of the GoToWebinar control panel. First though, I would like to begin just with a poll to gauge your current confidence with the general math competencies, such as what they are and why they're needed, adding these competencies into your delivery, and even teaching students these competencies. So 1 is little to no confidence, and 10 is extremely confident. So if you just put your results onto that poll that's on screen now. Okay, we got the results in. A bit of a mixed bag, no one at the very top end or at the very lower end, so very much around the middle-ish range with most people here. Hopefully we'll get a lot more people up to the upper end by the end of today's webinar. So first, just those quick introductions. So my name is David Kiernan and I work in the provider development team at NCFE. And my role is to support teachers, lecturers, assessors, etc. with the delivery and assessment of the health and science T-level qualifications. And these webinars are part of a collaboration with STEM Learning, and we will be working closely with them, but in particular with Chris Carr, who is the Network Education Lead. These areas, which will have an NCFE webinar with additional STEM learning sessions, are today's session, for example, on the general maths competencies. There'll also be Prep to Teach Science T-Level webinars, the Biology, Chemistry and Physics Core Concepts webinars, and Health, Safety and Environmental Regulation. And the STEM Learning website does contain further information regarding these. We'll begin with a brief overview of the T-Level and the assessments, but for much more comprehensive information, please do see one of our onboarding webinars. So what is a T-Level? A T-Level is a level 3 2-year program aimed at 16 to 19-year-olds, and they are equivalent in size, depth and rigor to 3 A-levels and attract UCAS points. T-Levels are owned by the Institute for Apprenticeships and Technical Education, or IFATE, and the design and content of the T-Levels came from employer panels in the relevant industries. And because of these employer panels, T-Levels do offer students a route to paid employment, and UCAS points are also available for the completion of a T-Level, so students can progress onto higher education or onto a higher level apprenticeship. And the entire design of the T-Levels is to ensure that students have the threshold competency for the relevant occupational role. And that is one of the most important aspects, ensuring that students have that threshold competency. So the specification itself can be divided into 2 sections: the core component, which is shown on screen now, and the occupational specialism content. So the core content is further subdivided into 3. Section A, all about working in the health and science sector. Section B, the scientific knowledge, concepts and understanding of biology, chemistry and physics, and the core skills. So this core content and skills form the foundations that the occupational specialism content and skills is built upon. And some of this core content is also root core content, meaning it will be common to the health, science and healthcare science T-levels. For section A, The root content is the 4 bullet points shown on screen. And everything in B1, the core science concepts, is also root content. Then we have the content and knowledge specific for an occupational role. And these are the occupational specialisms that are currently live for the 3 different T-level pathways of science, health, and healthcare science. The content, knowledge, and skills will be different from one specialism to another, as it is all about having the threshold competency for that occupational role. The T-level assessments can be broken down into the core assessment and the occupational specialism assessments. The core assessments consist of 2 written exam papers covering the core content in Section A and Section B, and an externally set skills assessment called an employer set project. So called as the tasks had input from employers to make them as realistic as possible. The occupational specialism is assessed in Year 2 with externally set synoptic assignments, which are also designed to be as occupationally realistic as possible. All right, let's now have a check of these competencies and where they are embedded within the specification. All the T levels contain general English, maths, and digital competencies, which will be essential to help students develop their threshold competency and improve their employability skills. The focus for this webinar will be on the maths competencies, which are embedded within the specification and will be in context to the pathway. And they were also assessed as part of the T-level qualification. These are the 10 general maths competencies. And as mentioned before, they are featured in every T-level qualification. You may also teach competencies that are not listed here, where they naturally occur, but these will not be subject to assessment. But it certainly would be useful to develop students' threshold competency. The Royal Society's Advisory Committee on Mathematics Education in 2011 published a work called Mathematical Needs, Mathematics in the Workplace and in Higher Education. And they found that employers emphasize the importance of people having studied mathematics at a higher level than they will actually use. That provides them with the confidence and versatility to use mathematics in the many unfamiliar situations that occur at work. And Professor Sir Adrian Smith said in his DFE 2017 review of post-16 mathematics, defining the appropriate mathematics for each of the technical routes is likely to be complex. The mathematics should be designed to reflect the requirements of the relevant occupations, wider society, and the emerging economy. It needs to be coherently structured, taught, and assessed. Now, this contributed to the development of these general maths competencies, with their core purpose being to enable students to engage with mathematics in ways that capture the essence of working mathematically in vocational contexts. There are different elements of mathematics within the specification already. The Section A root content on managing information and data includes aspects such as qualitative and quantitative data, data collection methods and data analysis, data presentation such as tables, graphs, charts, etc. There are further examples such as A6 in the health T-level on data handling and processing. For example, different formats for the sharing of information to summarize findings. A8 in healthcare science T-level on managing information and data also contains content regarding formats for communication and presenting data, the principles of methods of statistical analysis and interpretation, and many more examples within the science T-level too, such as A6 on data handling and processing, A9 on scientific methodology, and A10 on experimental equipment and techniques. Some examples of this content includes qualitative and quantitative data, how to minimize errors, different methods of data processing and analysis, statistical techniques, making micro and macro scale measurements, choosing appropriate equipment for kilo to nanoscale measurements, etc. The root content of B1 also has specific mathematical opportunities, such as calculating the magnification for a microscope, use of radioactive decay graphs, the wave equation, various electricity calculations, conversion of units and using significant figures. There are more examples within B2 content too. For the health and healthcare science T-levels, there are physiological measurements, such as blood pressure, pulse measurements, respiratory rates, heart rate, temperature, weight, etc. And epidemiology and identifying trends and patterns, the progression of diseases, etc. The science T-level, B2 content, includes relative molecular mass calculations, moles and concentrations, reaction rates and Maxwell-Boltzmann distributions, RF value calculations in chromatography, gas law calculations, etc. The third section of the core component is the core skills. And the specification does specifically mention where the general maths competencies are embedded. There's also a list where the maths competencies are embedded within the occupational specialism skills content too. But we're just going to focus on the core content today. So for health, they are in core skill 2 on communication. For example, communicate effectively with a variety of stakeholders, presenting data, using calculations, diagrams, and data to support assertions, etc. In core skills 5, on researching, requires students to study sources, analyze data / information to draw conclusions, identify suitable data from research, professionals and patients to allow interpretation and analyze findings, articulate findings through a variety of methods. For science, they are embedded in core skill 1 on project management, such as financial forecasting, taking into account resource requirements, and using mathematical processes to support forecasting. Core skill 4 on creativity and innovation has gathering information to make improvements by collecting data, recording results, systematically organizing and recording data prior to any scaling or processing, etc. Core skill 5 on problem solving is regarding solve a problem using a science context by implementing the changes, using new technologies as appropriate, gathering data, recording data, etc. Core skill 6 on communication mentions selecting the appropriate way of presenting data, using images and other tools to clarify complex information, highlighting benefits using calculations, diagrams, and data to support these assertions. And then in core skill 7 on reflective evaluation, for example, has content on the accuracy and reliability of results, reproducibility, quality of the data, including how the data has been processed and scaled. And for the healthcare science T-level, we have embedded maths within core skill 2 on communication skills, with examples being selecting the most appropriate way of communicating, using images and other tools to clarify complex information, communicate benefits to stakeholders using calculations, diagrams, and data to reinforce these assertions, and core skills 5 on reporting and presentation skills, including identifying, collecting suitable data, process, interpret, and apply data accurately, demonstrate an understanding of the nature, type, quality, and reliability of data, select and implement the correct data analysis technique for the task, present a report on conclusions using graphics and other tools to aid understanding, ensure data is presented in an appropriate manner, such as the type of graph or chart chosen. And these general maths competencies are assessed within the T-level qualifications. The core written papers contain marks for mathematics. The employer-set project has 5 assessment objectives, with assessment objective 4 being about using English, maths, and digital skills as appropriate. And the synoptic assignments in year 2 also require the demonstration of various mathematical skills. As mentioned in the previous slides, the specification does list where these math competencies have been embedded within the occupational specialism content. We are now going to look at each competency in turn, and I'm going to turn this actually over to you first. So what do you think is meant by the different general maths competencies? What are students required to do? What subsections could you break the competency statement into? For this, I'd like you to add your comments under each section on the Padlet. So you can either scan the QR code or just use the link that I've popped into the chat. So I'll give you about 10 minutes for this activity. Okay, thank you everyone for those suggestions that we have seen come in here. So we have General Maths Competency 1 regarding measuring with precision. We have got basic lab skills, taking readings from equipment such as titrations, good. Using the correct tool and scale for the task. Spotting anomalous results in terms of the estimate and calculating error spotter. Sense checking, which is often overlooked, just to see if they're on the right lines. Working with proportions, so scale drawings, interpreting and using, ratios, using rules and formula, so body mass equations like the Ohm's law one, molar equations, concentration, etc. So you have processing data, carrying out an experiment and drawing conclusions, or being given data in an exam question and being asked to interpret it. Results tables and graphs, good. So understanding data and risk, so evaluate the data collection methods and making judgments on reliability. So number 7, interpreting and representing with mathematical diagrams, so the use of graphs and pie charts to display data. Communicating using mathematics, so science communications, making data accessible to the general public, very nice. Costing a project, so possibly working with larger numbers. No comments for the optimizing work processes, it's fine. Right then, we'll now look at each of these in turn. Thank you all for those suggestions though. So here is an outline of what's meant by these competencies. And you may also find that you end up addressing multiple competencies with certain tasks. So they're not necessarily addressed in isolation. Measuring with precision can include choosing the correct equipment for the task, the units and scale of the measurement needed, taking account of any errors, such as zero errors and equipment that is off by a set amount. How this zero and systematic error could be affected with further calculations. The error could get compounded. Even reading calculator screens and choosing the appropriate number of significant figures or decimal places. So the estimation, calculation, and error spotting competency can require students to understand and have a knowledge of the context in order to find appropriate solutions to the calculations, using rules of thumb and making estimations. For example, the extra inch of height adds 5 pounds of weight if we're thinking about a health scenario. And it's useful to get a sense check of any calculations that have actually been performed. So students can be reassured their answer is in line with the expected outcome, the expected solution. Working with proportions can include using numbers, ratios, percentages, etc., but also graphical representations, determining trends and patterns. An understanding of directly proportional and inversely proportional, such as in graphs, numbers, or even just qualitative descriptions. Applying proportionality to make predictions, draw conclusions, etc. Using rules and formulae includes the specific examples that have already been given in the specification. General rules too, though, such as area and volume calculations, hierarchy of operators for multiplication, division, brackets, addition, etc. Being able to use formula to find different quantities by rearranging equations. Taking account of the units and dimensions and the effect when performing calculations, etc. Processing data can include how the data is collected to begin with, what technology, such as spreadsheets, is used to process the data, how the data is represented and processed, such as tables or a chart or graph form, and being able to interpret already processed data, such as drawing conclusions from provided graphs. Understanding data and risk can include the source of the data, so primary or secondary sources, being able to critically evaluate data, making predictions and drawing conclusions from the data, considering how the data was generated, sample sizes, data source in terms of possible bias, etc. The mathematical diagrams includes the creation of suitable diagrams, charts, infographics, etc., but also being able to interpret diagrams and charts too, using technology in their production and setting suitable scales, trend lines, etc. Communicating with mathematics includes the use of calculations and diagrams to represent your findings and support your conclusions, your judgments, using different methods for different audiences, such as information for the general public versus information for professionals or specialists. The costing of a project can include financial planning, considering the various costs involved, such as equipment, space, time, resources, labor, etc. Being able to justify a budget for a certain project. Taking into account risks that could potentially impact on any plans, etc. And finally, optimizing work processes can include identifying problems from data gathered, such as time requirements, efficiency, financials, etc. Suggestions for improvements and any resulting calculations, such as the amount of time saved, how it would affect resources or equipment costs, etc. Gather data to analyze the impact that the changes have and evaluate said impact. We'll now look at some examples of where we could embed these competencies further. Activities that could be done with your students, etc., just to ensure that they do have that threshold competency. Now, while I have my own ideas, which I'll share with you, I would like to get your suggestions first. So can you think of any activities that you could do with your students? Are there any areas of the specification that you would include further mathematical opportunities? And what I'd like you to do is add some post-it notes to the Jamboard with your suggestions for your particular specification, whether you're doing health, science, or healthcare science. So you can either scan the QR code that's on the screen now, or you can click on the link that I've just put into the chat. So again, I'll give you about 10 minutes or so to have a go at that, please. Okay, thank you very much, everyone, for those suggestions. We can see them here on screen. So for health, we have empirical versus metric units. So I suppose pounds versus kilograms, aspects like that. Inches versus meters, centimeters, and so on. Reading ECGs, yes, indeed. Blood pressure units, good. So we have changes in heart rate on resting activity, okay, good. O2 levels in the blood, absolutely. BMI calculations, yeah, very nice. And we have some science ones here. We have students presenting given data to class and explaining it. So science communications, infographics, good. Using averages and interpreting data, yep. Inquiry-based learning approaches to practicals, excellent, yeah. Being able to calculate the rate of reaction, all right, good. So the amount of reactant or product over time. Being able to calibrate equipment, absolutely. Making sure something's zero, absolutely. Calibrating equipment. And these ones sort of hover over a bit of health care science and science by the looks of things. The use of graphs, quartiles, etc. And we have costing out the equipment needed for a task or project. Excellent. So a lot of suggestions there. Thank you everyone for sharing your suggestions and ideas. So this is just a few of my own suggestions here. And again, I've focused on the root content here because that would be applicable to all three pathways. So it'd be applicable to health, to science, and to healthcare science. Now, I'm not going to read out each of these, but I do want to highlight a few of them. So one example, showing a scaled cell diagram, and students have to estimate the size of the organelles, percentage difference or ratios, or even how many times bigger a bacteria compared to a virus is. Give students a budget maybe for a lab that will be carrying out certain investigations with cells. So students cost the number of microscopes needed, the type of microscope as well, any stains that might be needed, etc. Students could even consider staff numbers, the amount of space that they'll have. For optimizing processes, it could be using digital pH meters over a universal indicator for pH measurements. So students could time how long a pH reading takes with a universal indicator versus a digital meter, which is more time efficient, etc. For the materials section in B1, you could even link in an extra little bit on mining for limestone to make concrete as an example. So this could include financial forecasts and determining if it is profitable. One example that I've used in the past is to use some chocolate chip cookies, where the students would extract the chocolate chips and check the mass of the chips, and then be given various financial costs and need to determine if they would have made a profit from selling the chocolate chips to justify the cost of the mining. So you could set your own figures for that, depending on how much mass equals a certain amount of profit. And you can have students use the COVID-19 data, which can be downloaded from the government's website, and process the data into graphs using spreadsheets, etc. As mentioned earlier, there are probably more opportunities for the science T-level, but there are other health examples too, such as BMI calculations, which was suggested there earlier, and using charts, changing height measurements from inches to centimeters, mass from pounds to kilograms, reading blood pressure graphs, or considering scaling for blood pressure readings in millimeters of mercury. Giving a pulse rate in beats per second and students to convert to beats per minute, etc. So we're now going to finish off on some of the support and resources that we do have available to you. So I'm going to talk through these resources that are currently available from NCFE and what other third-party organizations are doing too. Our content team have developed and made available example schemes of work for the core content, as well as teaching resources to help with delivery. There are essential resources, which will be free, and additional resources available on a yearly license. And these resources will contain an e-learning resource / presentation, activity sheets and/or home study sheets, which will be interactive PDFs, and a session plan to accompany the e-learning resource. You may find other free resources on the health and healthcare science pages too that could be used with your delivery of science and vice versa. And aside from our resources, Other are producing a textbook for the health and for the science T-levels, which is due to be released shortly. And STEM Learning have a T-level resources page. And this page is broken up into Section A and Section B of the specification and contains links to various resources. And there's also a section for the General Maths Competencies. And while the focus of this page will be for the science T-level, you will find content relevant to the health and healthcare science T-levels too, since some of the content is shared, as we've been mentioning, the root content as it's called. We have an interactive PDF with our upcoming events and webinars, the first page of which is shown on screen now. And it has all the planned sessions for the duration of your T-level program delivery. The second page is now shown, which does break up the support we offer into different types of pre-onboarding, onboarding, and further CPD, such as this event. I've included the link to the T-level provider support page on where you will be able to find our schedule of events. And I've also included the link there to any of our previous webinar recordings, which will be added to YouTube. And that is the direct link there to our T-level playlist. STEM Learning has a CPD platform as well, where you can search for upcoming sessions for the T-level. Now you will need to register with STEM Learning first, and I've also included the link to their specific T-level landing page, where you can go straight on and access and look at the different CPD courses, the resources available, the Catalyst magazine, which contains lots of information as well, and much more. And this slide provides information regarding the key contacts. So the customer support team are often your first line inquiry for registering students, accessing the portal, etc. As for me, I'm your contact for support relating to teaching and learning and CPD sessions. And the account managers support centers with the business of delivering T-levels. And centers do find having that singular point of contact with their account execs very, very valuable. And for contacting STEM Learning, there is an email for general inquiries as shown on there. And I've also included Chris Kerr's email too. I just want to finish off with the same poll I asked you at the very start. How confident do you feel regarding the general maths competencies? So after today's webinar, how are you feeling now? Again, 1 is little to no confidence, with 10 being extremely confident. Okay, looks like we got all the votes in, and majority of people are in the 7 to 8 range, about 13% actually, a few were actually in the 9 to 10. Good, and just a few, we've got a few percent also. Yeah, there we go, the final votes are in now. And we've got about 11% of people, there it is, 11% in the 5 to 6 range. So if anyone's still in the 5 to 6, remember, do ask any questions into the question box if there's anything you want clarification on, or maybe a case of just getting into the delivery and getting used to the requirements. So we'll be remaining on here for the remaining 5 minutes or so that's left. So if you do have any questions, please put them into the question box so I can support you as best as possible. And if you are leaving now, then please do fill in the little evaluation that will pop up. Really appreciate your feedback. It's vital to us so we can support you as best as possible. And if you are leaving now, then from everyone here at NCFE, we would like to wish you a very safe and successful year.